So working in the Philippines, it was more of doctor-led. So doctors do their rounds, they give out their orders, and you have to do what they want you to do. A lot of times it's more of yes doctor, okay doctor, yes doctor. Here in this country, it's more of nurse-led. There's a lot of nurse practitioners here as well, and it seems like nurses here has power, and you can challenge your doctors as to why this, why that. And you would hear as well from a lot of doctors here who would say, if you want to learn something, go and ask that nurse, because she's the one who's been looking after this patient. She's the one who knows more about this patient. So if you want to learn something, you go and speak to that nurse. Earlier, what I said, I was a stroke nurse specialist back in 2012. Yeah, 2012 to 2014, I was a stroke nurse specialist, which means that when the ambulance picks up stroke patients, they give us a bleep to say that there's a stroke emergency, and I have to meet them in, they call it A&E, accident and emergency, instead of emergency department. And then from there, I'm the one who assesses the patient. I'm the one who requests for CT scan of the brain. And if I think that the patient meets the criteria for thrombolysis, then that's the time when I contact my doctor, or my registrar, is what we call it here. And he would speak to the family, he would speak to the patient while I prepare the medication, and a lot of time I also administer the medication. So it's very nurse-led in this country. In terms of disadvantages, I suppose at some point I think everyone has, or everyone will experience some sort of discrimination. I guess that's just how the world is. Everywhere you go, there would be some sort of discrimination. But a big but. I myself have not encountered one. I have heard of a few stories about it, but I have not encountered one. All of the people that I've worked with has been amazing, whether they're white, whether they're black, whether they're brown, they've all been amazing. But I suppose it's just one of those things that working in a different country, you just have to deal with it and stand up for yourself, and depends on how you fix the problem, really. So in the Philippines, of course, it's taboo. I also have this feeling that in the Philippines, gay men are more acceptable, or are more accepted. I don't know why. But yeah, at that time, I didn't really come out. I came out to my mom when I was in uni, when I was in college. And that's also the time when I came out to my sister and to my brother. I didn't really do it with my dad, because my dad is a very strict and conservative Chinese man. So that's one of the things that I suppose persuaded me to come to a Western country, because here it's more acceptable. I mean, don't get me wrong, we do have different cultures, we do have different religions here. So I'm not saying that everyone has accepted or is accepting, but the majority is. So yeah, so I came to this country and didn't tell anyone at first that that I'm not straight. And then I remember having this conversation with one of my colleagues who's English, or who's white. And when I came out to her, she was a bit baffled that I was saying it in a serious conversation. And she was like, yeah, that's cool. I don't know why you're telling me this, but yeah, that's cool. So at that time, I realized that in this country, I could be myself, that I could have friends and make friends where I didn't have to hide. Because I remember there was also a time where I came out to one of my friends back home before I left, and it was the whole, but why? Why are you not straight? And I just diverted the question back to her and just said, well, why are you straight? So yeah, people here are just a bit more open-minded. Not a bit, but people here are open-minded and are more accepting. I have encountered a lot of people where they look at you as a person rather than if you are straight, if you're gay, if you're black, if you're white or brown.